So, good morning everyone. Thank you for joining us on this lovely Saturday morning. Welcome to Organise 2020. This is a 3-day event hosted by the TEC, the last of 3 days, but this session, as I said before, is absolutely the highlight of the 3 days. My name is Cheryl. I'm the Health and Safety Officer at the TEC, and we've got 5 fantastic speakers to hear from this morning, all of whom are women, trade unionists and organisers on health and safety in the workplace. The motivation for bringing this session together was that health and safety has always been one of the most critical trade union roles, but in the last few months it's been at the forefront of everyone's minds. And while we've had to deal with a reckless government and negligent bosses, which has created a crisis in our workplaces and a devastating death toll, it is without a doubt that trade union reps such as these women have ultimately saved lives. And while there are structural inequalities within our economy, which mean that it is women workers, it's black workers who are more often in those frontline roles that leave workers more at risk of exposure to coronavirus, as well as other workplace hazards. Our union movement has work to do in fighting to overcome that ingrained racism and sexism. And when it comes to representation alone, women make up the majority of trade union members at around 55%, but we only make up a third of all health and safety reps. That's despite various workplace hazards being a particular risk to women workers. So we'll be hearing from these fantastic reps on what motivated them to get involved in the health and safety rep role, what kind of organising they've been involved with, what it's like being a health and safety rep during the coronavirus pandemic, and how does the movement work to get more women stepping forward and becoming reps. Our first speaker is a health and safety rep on South Western Railway. She's been involved in the long-running Keep the Guard on the Train dispute over safety, and during the pandemic, been on the front line organising for safety for transport workers, which is of course a high-risk workplace. She sits on the RMT's Health and Safety Committee, and I want to say a big warm welcome, if you can give her a big warm welcome, although we can't hear your applause, maybe you can do it anyway, where you are at home. Please welcome Hayley Bouchard. Hayley, over to you.
Good morning, everybody. Thank you very much for joining. My name's Hayley Bouchard. I've been a trade union activist for over 40 years now. Firstly in the NUS, then the T&G, ASLEF, and now RMT. I've worked as a representative, however, for 25 years. How I came to be a health and safety rep. I've actually worked as an industrial relations rep since 1995 after I joined USDAW as a trade manager. I then had 2 children and I changed companies. I moved to SWR as a clerical officer. Once at SWR, I stood in an election for an IR representative place against another rep, but lost against the incumbent male. Then a health and safety position became vacant, so I stood. I was unopposed, so consequently I did win. That was 10 years ago. So I undertook the requisite training at the local college, which was 1 day a week for 10 weeks for stage 1, and then further training to complete stage 2. These courses are absolutely invaluable for anybody thinking about becoming active or standing for a position. Your union may also run their own educational courses, which I can absolutely recommend as a great way of learning and finding out more about the role. The normal tasks I'm involved in as a health and safety rep are 3 monthly walks, so covering all the areas of the stations. We look at the health and safety notice boards, any equipment, risk assessments, which are hugely important, the accident book, gate lines, safety signage, the condition of the workplace, platforms, stairs and flooring, COSH substances that are used within the workplace, PPE, and also look at the environmental factors. Lighting, emergency plans, fire equipment and alarms. So essentially anything to ensure that the workplace is safe for both staff, visitors and passengers. These reports are then fed back to the managers who are supposed to rectify any problems, but if they're outstanding for more than 3 months, we then escalate to our quarterly health and safety meetings with the area manager to try and push for a solution. The difficulty on the railways nowadays is that we are only the operators, and therefore there are only some faults which are within our remit to fix. Others are the responsibility of Network Rail, who own the infrastructure and are always short on their budget. That's privatisation for you. The types of issues I've organised around As a train manager at USDAW, we conducted a strike for that grade, which was a fight about having equality of a pay rise with drivers, bearing in mind we were also emergency drivers. I was on picket line duty at 3 a.m. Yeah, it's 3 a.m. in the morning, not in the afternoon, and until about 7 in the evening. Solidarity was shown by our colleagues, however. The drivers, only 2 of them crossed the picket line. The company, in their wisdom, decided to take us to court, and the strike was declared as invalid because the drivers hadn't been balloted. However, that day, very few trains ran, and management did get back round the table, and we negotiated an acceptable pay rise. More recently, obviously, on SWR, the guards have been on strike to try and ensure their role on the train remains a safety critical role. Because of anti-trade union legislation, which means that no secondary action can be taken, unfortunately, I have had to attend work. But also, every other manager in the business were trained up, inadequately by the way, to operate the trains. They were all being paid extra, and in fact, some of them were bragging around the extra £4,000 they would earn over the 4-week period in December. They were actually disappointed when the union were back in negotiation to try and resolve the situation. However, those talks failed, and they were paid their bonuses by an organisation who, every time we come to a pay claim, claimed poverty. Organisation around this strike for me was more about fundraising and support of the guards, but also other workers who received quite a lot of abuse from passengers on a daily basis because of the reduction in our train service. Although I have to say, on the whole, the support for the guards from the public was very positive. During the pandemic, it's been particularly difficult. Essentially, on the railways, it's the Department of Transport who are paying our wages rather than First Group. So therefore, they're the ones in the decision-making capacity. They make their decisions, they're then discussed at senior union level with company council and senior managers, and whatever is agreed is passed on to us local reps to ensure the workplaces have all the mandatory equipment and correct procedures are in place and followed. My area consists of 53 stations, and there are 3 of us reps covering that. The toughest element probably has been the timescales. For instance, we were given 3 days to cover these 53 stations, which meant I covered 15 stations in 3 days and conducted a COVID-19 risk assessment at each of these. During those health and safety visits, I have to rely on our service to transport me from place to place, making it quite difficult logistically and time-wise. Perhaps next time I'll just have to grow some wings. One thing I've been asked to talk about is trying to diversify the reps that we have in the workplace, which I think is absolutely necessary so that we have a diversified representative body that reflects our communities. It'd be fantastic to see more women, young and BAME members becoming reps so that the workplace is more inclusive. I think the starting point is to trust yourself and your ability. Get involved with your local branch and attend the meetings. Find out who the reps are and whether there are any vacancies. Talk to the reps and if necessary, stand in an election. But also sign up for the education courses, which are a great way to meet other activists and learn about other organisations and businesses and the problems they face. In completely diverse workplaces, it's surprising how many similarities occur. On a personal level, I actually met my partner, who's an ASLEF rep, through my work with the union. So 17 years and 2 kids later, I should have been on my honeymoon this week, but instead here I am on another Zoom meeting. I've had the opportunity for the last 5 years of also sitting on the RMT National Health and Safety Committee. I'm the only woman on that elected body. Principally, we look at best practice for work procedures and policies, discuss and try to find solutions for problems that are endemic to the transport area. We also organise the annual Health and Safety Conference, which is the largest conference in the RMT calendar and supported by approximately 130 delegates. Excuse me. These conferences are another fantastic opportunity to learn and meet other like-minded members. It also gave me the chance last year to attend a health and safety conference in Lisbon with guests from all over the world. Believe it or not, it was somewhat different to my usual port of call, either London or Doncaster. Anyway, thank you for listening to me, but more importantly, believe in yourself, get involved, and face the challenges our society brings within the family of the union. Anyway, thank you. If there are any questions later, I'd be happy to answer.
Thank you so much, Hayley. I thought it was really brilliant to hear about the range of issues that you've taken industrial action over, and a real illustration of how difficult the job of a health and safety rep is with all those stations that are in your remit, and a reminder to everybody who's watching that we need more safety reps to ease the workload on people like you. A really great plug as well for the importance of health and safety education offer that's offered by unions and how much members can get out of it. I'm so sorry that you're not on your honeymoon, but it's lovely that the movement has brought you and your husband together, and I hope those two kids will follow in your footsteps in becoming militant union activists as well. Our next speaker is actually very new to the health and safety role. She is not new to union and community organising. She works at St Mungo's homelessness charity, which days before the lockdown were out on strike over numerous issues, one of which being their charity sick pay policy. She's a rep with Unite, and she's also president of Lewisham Trades Council, which is where I live. So thanks for your representation. Welcome to the screen, Cheryl McLeod.
Oh, thank you. Wow, I don't even know if I can follow Hayley now. I think I just want to go and hide somewhere. So thank you, Hayley, for that. And thank you, everyone, for actually coming on the Zoom to hear me as well. So, yeah, So yeah, as Shelley quite rightly said, before we was on, before we went into lockdown, we was on in dispute with our employer, St Mungo. So it was a time where we was thinking, oh my God, you couldn't make this up. We're on strike. People are shielding. They don't want to. They don't want to come onto the rallies and so forth. But you know what, we did manage to get some people out there. So and some of the issues that we was which we was actually striking over was in one of them, as Shelley quite rightly said, was the sickness policy, where it was so draconian in terms of how they wanted staff to report their sickness when there was their absences. So what happened was they would want you to report to two separate entities. So that would be the HR and also to management as well. So what I used to say to my staff, because I'm also a manager as well. So yeah, I'm in a peculiar position there. So what I say to my staff is to actually just send an email to absence and to HR and to myself, management as well. So therefore you're not going through that process. So but not all managers will do that and have that sort of empathy to staff, because it is really, really, really bad. We had like 10 issues that we was actually striking on. So one of the issues as well was in terms of the collective bargaining, so like the employer, their refusal to provide us with the employees list for our collective bargaining, and they was literally in breach of the recognition agreement around that. Also, one of the things which actually hit the newspaper headlines was the employer sharing client information for immigration enforcements as well, without the client consent, and the absence of serious risk to those clients and also to the outreach staff as well. So, you know, our then CEO, who's now departed last week, he actually said, oh no, they wasn't doing this, they wasn't doing that at all, and he vehemently denied it until we actually did find out that it was one particular service that was actually doing this, and he had to admit that yes, it did happen and he wasn't aware of it. So he was literally moving the blame onto somebody else. So these are the sort of things that was happening within St Mungo's. But also in regards to the sickness policy as well, the monitoring and review period of the sickness policy was like around 16 months if it was stage 1. So if you became sick within 16 months again, you would automatically move to stage 2. So St Mungo's, they knew that this was a really sticking point with our members, and they knew that they had to back down on this. So they did actually relent and reduce the duration of the review on that. Sorry, am I cutting in and out because my internet's just saying that I'm unstable at the moment? Not me.
You're absolutely
so
fine
I
for
hope,
me at least.
Brilliant. Okay,
Yeah.
great. So yeah, I might cut in and out. My internet is terrible. So yeah, so they literally relented on that. So that was one good thing. But the other issues that's happening within the dispute is not being taken on board, and we're still trying to come to some resolution with the new CEO. I don't know how well that's going to go, but we'll wait and see. So now, to me, becoming a health and safety rep, I was like, oh my God, I can't believe this. I thought there's no way that I'll ever become a health and safety rep. I just thought, no, this is not for me. This is for jobs worths, basically. That's how I always had seen it. All right. So I'm really sorry. All right. But no disrespect. But what I always say never, you know. And so you only know how important a job role is until you're caught up in that crisis. Then you realise that, yeah, that role is actually absolutely important. So during the pandemic, I couldn't believe how the housing associations and organisations and the country was actually dealing with this virus. And I still believe, I'm going to be a bit controversial here, but I still believe that there should be a class action brought against this government in the terms of criminal negligence in the way how they've implemented the lockdown, and in terms of easing it too late and easing it up too early, and also coupled with the high death rates. That is my thoughts, and it would be great if somebody could actually, the TLC should be leading the call on this. So locally in my organisation, I found that we was actually being more reactive than instead of being proactive. So there was all different information that was coming through. Workers, how they was working, the PPE, like for example, my particular service, I spent like over, I think it was £700 on PPE alone before we was actually going really, really bad. So I managed 4 different ex-offenders units. So with that, my regional head, he literally hammered me and said, how come I'm spending so much money? I said, you know what, I'd rather spend that money on the PPE than have it on my conscience that one of my staff members have died through my negligence. So I will spend and I will spend and I will spend. So basically he wasn't happy with with what I had said. So but for me it was about making sure that my staff was protected. So you know, in terms of where we are now, when I attended a union branch meeting on the 6th of April, and I literally asked how much health and safety reps we had for an organisation of 2,000 plus, and they said only 1. And I was like, oh my God, do you know what? He was doing a fantastic job. Don't get me wrong, he was doing a fantastic job, but that was a lot for him to be doing on his own. So I said, you know what, I'm going to step up. Can I be put forward as a health and safety rep? And they said, yeah. And then surprise, surprise, by me just saying that, 3 other people joined as well. So in total, we've got 5 health and safety reps now. So we've got another African Caribbean woman and 3 men. So yeah, we've really done well on that score in terms of just recruiting. So, and also for me to be a health and safety rep, it helps the workers as well, because they don't want to ask the management those awkward questions. So and because of fear of reprisal. So being that kind of stopgap, that kind of gap, it does also help the members as well, so they can come to us and say where there's no PPE and so forth. So so in terms of that now, so with the rises of the with deaths within the bus sector, the national health, and also within our sector as well, social care, the African and Asian and ethnic minority community have been treated with total disregard within this pandemic. The exposure of the health and the exposure of the health, wealth, and also the race divides in our society, the inequalities that have worsened over the past decade with austerity, which have resulted in increased deaths in poor and multicultural racial communities. So when the government says, you know what, there is no discrimination with this pandemic, this virus, yeah, there is actually. An African or African Caribbean man is four times more likely to die from this virus. Also, I'm in one of those high categories as well. As an African woman, I'm 3 times more likely, as well as my Asian counterparts, are 3 times likely to contract and die from this disease. But saying that, I was still working hard, making sure that I was going into work. I did have a choice of staying at home, but I didn't want to, because I felt my staff was being out there on the front line, and it's not about them and us, it's about all of us together. So yeah, I still was going to work through the pandemic. So I was also putting myself at high risk in terms of traveling, because I also work in the Islington Borough. So so for me, it is a thing where I know that to organise and try to mobilise other reps. I also had done a blog on my Unite website and why I stood to be a health and safety rep, and was trying to put a call out for others to actually be a part of it as well. So so for me, it's a thing that we're going to have a lot of issues that's going to be going on after this pandemic. We've also got to take into consideration the mental health as well of staff, in regards to maybe their loved ones have passed away or they've been part of the pandemic. So we're literally taking that on board. We are meeting with our health and safety committee as well, which makes up of our senior management. And with that, they have tried to play some games, but because quite rightly what Hayley said in terms of tending training, I was absolutely able to draw the Health and Safety Act on one of the health and safety head of health and safety of our committee, and basically they didn't want to give us the riddle report in regards to one of the staff members who had contracted the COVID-19. So I did actually say, no, we have that right to actually see that under a particular section of the Act, which was section 7. So with that, she said, okay, but there's going to be information on there in terms of like their name and so forth. I said, no, that's fine. We don't need to know that. You know, you can redact that. All I just want to see is what actually the report says on it. And she had to relent because of what I had said, and through the education, what I had received on my previous training, I was able to bring up that Act. So the education part is also very, 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 very important as well to a part of being a health and safety rep. It's not just thinking that, yeah, you can win it. You cannot. You do need to use these different apparatus in terms of the Health and Safety Act, how you're looking at risk assessments and so forth. I can see Shelley's coming off, so I think I've overrun my time. But all I just want to say that just to wind up, I see it as a thing that I don't want the past norm, can't be the new norm, and I don't want the new norm, it needs to be a better norm. And that's the way how I see it, because otherwise we're just going to be back as we were, and doing the same old thing. So we have to have a new norm. So thank you, everybody.
Thank you so much, Cheryl, and welcome to the Jobsworth Club, I guess. You mentioned at the beginning that the CEO of St Mungo's has stepped down, and I just want to say I think that's absolutely no coincidence, and it's absolutely a result of the pressure from the union. I don't think it's controversial at all to say the government's responsible for gross negligence manslaughter, and I'd like to see a case being brought to, and I can see from the chat that a lot of people agree with that, so that's not controversial. Just looking at the chat, it's really great to hear from Penny, who says that at Edinburgh College they walked out before lockdown over the refusal to allow them to work from home. They said they didn't ballot, they didn't take notice of the rules around a threshold, but they cited Section 7 of the Health and Safety at Work Act. Andrea says this is very inspiring and is considering becoming a health and safety rep. That's exactly what we're here for. Another Andrea says that they've gone from 2 to 8 reps at the University of Oxford, and 50% of them are women. Thanks as well to Hilda, who's plugged some of the things that are worth people subscribing to, Hazards Magazine and the Risks newsletter that goes straight to your inbox every week. Thanks to everyone who's being involved in the chat, and just to say again, if you've got any questions that you want to put to any of these fantastic women, pop it in the Q&A box at the bottom of your Zoom screen. Our next speaker is not a workplace health and safety rep, but she is a leading voice on the fight for safety at work. She is chair of the Hazards Campaign, a UK-wide network of resource centres supporting those organising and campaigning for justice and safety at work. She's coordinator of the Greater Manchester Hazards Campaign and a long-time trade union activist, educator and fighter on women's health and safety. It's the brilliant Janet Newsham. Janet, the screen is yours.
Thank you so much for that. And thank you for inviting me to speak and share the platform with some of the brilliant health and safety reps here. Safety reps have always been the heroes of their workplace, keeping workers safe and healthy on a daily basis, and I'm really privileged to be here with you all today. I've been an active rep for over 40 years, since I attended my first trade union weekend school in women's weekend school in Blackpool. And my union TAS was the trade union for professional staff in engineering, and I worked in the IT department at British Aerospace. After going home and becoming inspired, I went next day to work and became the rep, and I have been active ever since. I think what was unusual for TAS at the time was it was a combination, it was a merger between a male union, draftsmen's union, and a women's union, which was the Traces. And as part of the merger, they agreed that there should be a women's structure throughout the union, and to ensure that women were still seen at every level, and to work towards equality and opportunity and pay, and ensure women's voices were heard. And I'm a firm believer, if you can't be what you can't see. And women's structure and task gave me a place where women could discuss and raise women's health, safety and equality issues, and their voices to be heard, as I said before. And I've met some absolutely brilliant, inspiring women and men, but many incredible women role models over the years who've supported me in every role that I've undertaken. And when I left British Aerospace to take a career break, to have children, I returned into training education, where I continued to be energised and activated by fantastic women's reps and healthy safety campaigners. So among many others, probably I was astonished to have been successfully appointed as the coordinator of Greater Manchester Hazards Centre, to follow in Hilda Palmer's huge footsteps, and subsequently chairing the Hazards campaign and the Hazards Conference, which is full in abundance of magnificent health and safety activists, many who happen to be women. Some women never have the opportunity to be active in the trade unions, but nonetheless have dedicated their lives to improving health and safety of others. And I stand on the shoulders of giants of the health and safety movement. It's given me the opportunity to meet and support the many women who've taken leading roles in fighting against injustice, campaigning on the environment and for safer and healthier workplaces, against exposures to chemicals and toxins that affect fetuses and children. Women like Helen Lynn from Pink to Prevention, and now Shelley in the TUC, and many others, health and safety officers and campaigners like Hilda. I've been inspired by women fighting against sexual assaults and violence on workers, against the triple jeopardy of exposures to chemicals in the workplace, at home, and in the combination of both to ensure that it's lethal for workers. Fighting for equality, women doing double day shifts, double shifts, working in the workplace and still carrying the main responsibility for home and caring, and then also suffering the carer's penalty with breaks in careers, low pay and stunted opportunities. Women have always inspired me, from the women in the Northwest negotiating menopause policies to those young women in the fast food sector fighting courageously to improve pay and for decent conditions at work, to those fighting in the hospitality industry for respect and dignity at work, and those in the many sectors, different sectors, fighting for simple welfare, toilets and sanitary access when they're menstruating. And now during this virus, those women who've been exposed to infection because it has eventually been acknowledged that their PPE designed for men doesn't protect them because it doesn't fit properly, and it never did. There's thousands that have died unnecessarily and this through this government's negligence. And, you know, we continue to remember the dead, but we will fight for the living. So this is why, and much more why, I've got involved in the Hazards campaign, hopefully to make a difference and ensure that safety and health is given the prominence, importance and priority it needs in our movement. And I think it's really important that we support our sisters and our brothers into becoming safety reps to make a real difference in the workplace. So thank you.
Thank you so much, Janet. It's really interesting to hear that it was the trade union women's movement in particular that got you kind of involved in the first place, and how many campaigns you've been involved in that touch explicitly and disproportionately on women workers. I have to say to everybody watching, Janet has been a crucial person for me since I took on this role at the end of February to learn from, and I very much encourage others getting involved in the Hazards campaign and signing up to their mailing list to find out what's going on. Next up, we've got someone with heaps of experience as well. I hope she won't mind me saying that she's been a rep for more than 20 years. She's a health and safety rep at Tesco, another workforce for whom there's been no lockdown, and organising for safety measures has been of critical importance. She's active on challenging all forms of oppression in the workplace, and she's chair of USDAW's Equalities division in the Northwest. It's another Janet, this time it's Janet Hankin from USDAW. Janet, thank you for joining us. Over to you.
Thank you, Cheryl. So I've worked for my my employer for 25 years, and I've been a shop steward and a health and safety rep for almost as long. I automatically fell into the role of a health and safety rep when I became a shop steward, and it didn't occur to me that I was taking on the role as a female health and safety rep, and that I wouldn't be, you know, any sort of less good at the job as a male health and safety rep. So I automatically fell into that. I, like millions of other women workers, juggle my day job, lots of other unpaid jobs, like I'm a wife, a mother, a grandmother, housekeeper, cleaner, carer. There's so many issues that we need to address when it comes to improving the health and safety of the women we represent. As a female health and safety rep, I am able to understand the issues and challenges that women workers will face in the workplace. Because of this, my female colleagues feel more comfortable approaching me for help and support, from pregnancy to the menopause and everything that happens to us in between. Our journeys to work, the dangers and demanding nature of the jobs we do, and the way we're treated by customers. My union campaigns on all of these issues. I'm going to talk about women's health. I'm mainly going to talk about women's mental health. So my union's focus before the outbreak of coronavirus is on how work affects the members' mental health, and whether members get the right support from work when it does, and that hasn't changed. Many aspects of our working lives have changed over the past 4 months. The coronavirus crisis has demonstrated just how dependent the entire country is on everyone working in retail, the majority of whom are women. To put it bluntly, without us, no one would get fed. But we're amongst those workers who are paid the least. Women like me working in retail are in jobs and workplaces that heighten our risk of exposure to the virus. And yet the work we do is apparently unskilled, something to do whilst waiting for a proper job, and something anyone else can do. This is the attitude that has threatened the health and safety of workers over centuries. And in recent months, it's made the shop floor, always a difficult environment, a dangerous one. It is entirely honest. To be entirely honest, work has been horrendously stressful from the beginning of lockdown. In fact, before that, take the early days of the pandemic, when people were panic buying, for example. We at first we thought, well, it was a little bit funny the way people were behaving, because they literally were acting as if they'd all gone a bit crazy. But then it did change. It quickly became quite frightening for us, and there have been many pressures placed on us. When items were restricted, we had to police that. For example, a pasta, paracetamol, toilet rolls, etc. If you remember. Can you imagine how difficult managing that was from a health and safety point of view? And when social distancing measures eventually arrived in stores, we were having to police that too. Queues outside of stores and the one-way system in stores. You all know this because you've all been shopping in the last few weeks. And yes, like you, the majority of customers have been respectful and understanding, indeed grateful. We've been asked how we are and thanked for the job that we're doing many times, something that rarely happened before. But there are horrible things happening too. Customers either not understanding or blatantly ignoring the measures put in place, not only for our safety, but for theirs as well. Customers reaching over us to pick items before we've had a chance to put them on the shop floor, on the shelves, coming right up to the perspex screens at the tills, spitting, shouting and swearing at us. And that has shown, so my union run a survey, which over 7,000 members responded in April. And it showed that since the beginning of the outbreak, assaults, threats and abuse have more than doubled since this time last year. Going to work every day to serve the public when you're putting yourself at greater risk of catching the virus and then being faced with abuse and harassment has been very frightening. It has caused anxiety and stress levels to shoot up. I'm going to read just a couple of remarks members have made, not because they're exceptional, because they're typical. They've said, I am scared to death to go to work. I have never suffered with anxiety or any other mental health issues, but I most definitely have got anxiety and depression now. And we are terrified. Staff are crying at work. And this is just one little snippet of what we were told. You don't have to be a mental health professional to understand that many USDAW members have been traumatized by their experience of working through the pandemic, and they need time and support to process and come to terms with it. And that's where my union comes in. And more than ever, USDAW is committed to talk about mental health. For many years, the union's It's Good to Talk campaign has reached thousands of members struggling to work for reasons relating to their mental health. USDAW's health and safety reps are and always have been a key part of this. Whilst running workplace mental health campaigns isn't possible right now, we've been finding other ways to reach out to our members, even if it means simply asking a colleague if they're okay, or being alerted to some of the changes in their behaviour or their usual patterns. By making it okay to talk about anxiety, depression and other mental health problems, USDAW health and safety reps have created a climate of work where members can ask for help and get the support they need. But as I've said, the source of stress and anxiety is the workplace. USDAW has also been clear that protecting our mental health isn't just by offering support once someone is in distress. It's also about addressing what the workplace might do to contribute to our mental ill health. That's why health and safety reps and the union's officials have been working with employers to ensure members' safety at work, to risk assess not only the physical but psychological hazards, and to make sure members have been given choices about how and when they work depending on their individual and family circumstances. So to finish off, I'll finish off by saying being a health and safety rep has never been more important or any more, in many ways, more satisfying. I would encourage any woman from any background to take on the role. Think about the advantages of having a female health and safety rep in your workplace and what that might do what that might mean to the women that work there. We are making work safer for our members in such an obvious way. This is trade unionism at its best, and making work safer for women and thereby safer for everyone. Thank you for listening.
Thank you so much, Shani. That was brilliant. I'm really grateful that you focus on mental health there. I think that's something that it's so important to frame in that way that you put it, that it's often work that causes mental health issues. They're not always things that we bring with us into the workplace, but actually our working conditions can create particularly work-related stress and other mental health concerns. And I think it's such a gendered issue as well. It's often the type of health and safety issue that women reps are more likely to deal with from members. And how, for people in retail workplaces like your own, how tough this period has been on you in terms of workload and often abuse as well. And the issue of harassment for retail workers is a massive issue before the pandemic, let alone during it. And I know it's something that USDAW has been challenging the government for legislative change on for a long while. So thank you, Janet. Our next speaker is a health and safety rep at the Department for Work and Pensions. She's led colleagues into action over management's use of excessive monitoring and workloads, and is currently resisting moves to send workers back into unsafe workplaces. She's the Vice President of PCS Union's DWP group and also President of Cardiff Trades Council. Katrine Williams, it's over to you.
Thanks, Shelley, and I think it's a great panel and to be involved in terms of women reps and health and safety. And I think I became a health and safety rep probably almost by accident. I was already an office rep. Our health and safety rep left in the mid-90s. I was asked if I would take on the role, and the rest is history, really. And I've been a health and safety rep ever since then. And I think certainly it enhances what we can do as union reps in terms of that understanding around health and safety. A lot of the issues, they aren't just issues that affect our members in the workplace in terms of the way management treated us and the HR policies, but also bringing in that health and safety knowledge can be really helpful. And I think all the issues around stress, pressure, workload, staffing levels, they all impact on health and safety. And I think as a union rep in one of the government departments that is probably at the sharp end of the government's sort of welfare agenda, then clearly health and safety is really important in terms of what we do, given the sort of position that the government is putting us in terms of the job roles that we have. And I think certainly whilst we're campaigning for a decent, supportive welfare social security system, then clearly we're having to deliver the government's agenda in our workplaces. And I think certainly one of the first disputes I was involved in as a union rep was our screens dispute, when we were actually trying to retain the screens in our social security offices when they were actually creating the Department for Work and Pensions. And so I think health and safety has been at the forefront, but most of the disputes have had some health and safety angles. As you said, Shelley, my office was one of the first offices to roll out from being a benefit office, where we actually had quite good job design, control over our working day, providing support both on the phone and in correspondence with the public, to becoming a contact centre with very enforced regime, control of everything we did. We were told we had the maximum 14 minutes a day to go to the toilet. We were told when our breaks and lunches were, and so on. And it was a very clear impact on not only our working lives, but also on the services we were delivering to the public, because we were told to finish our calls as quickly as possible, regardless of what was needed by the member of public ringing us, and offload that to somebody else hard pressed to try and deliver the answers. And we had a long-running dispute where we improved the working conditions, and we made it clear that they shouldn't separate telephony completely from the job you're doing in terms of delivering the benefit services, and got improvements there. And now obviously, as you said, that because we're a government department, the ministers want us to look like everything is back to normal, that we're not still in the pandemic, and they're rushing to reopen the doors of job centres. We have been providing services all through the pandemic to the most vulnerable in society. Anybody that can't use telephony or digital means to contact us, we have been providing that service face-to-face throughout. But just reopening the doors without regard for the safety of the public and the safety of our members is irresponsible. Ironically, given that I started off in a screens dispute to try and retain screens, management have been rushing to actually introduce screens into our offices because of the COVID risk to our members. But screens that probably are more risky in terms of the environment. They don't seem to be particularly stable. They don't seem to be fit for purpose. and a number of the screens have actually smashed on installation as well. So there's all sorts of big issues for our members. And, you know, whilst the majority of our members have been in the workplace throughout the pandemic, they haven't actually needed to be in the workplace. The majority of our work could have been done safely from the home, but unfortunately our department was woefully inadequate in terms of delivering the IT kit for our members to be able to work from home. So we're still pushing for more of our members to be able to work from home and deliver those services safely to the public, but also ensure that we can deliver the services to the public safely in their own homes, rather than bringing them into job centres unnecessarily as well. So, you know, I think it's been quite challenging. Obviously, the workloads of our department has mushroomed and overwhelmed us overnight, but I think what has been good during the pandemic is actually concentrating on what really matters, which fits in with the union agenda on social security, is concentrating on paying the public and providing the support to the public as well, rather than actually chasing people and enforcing some of the welfare agenda of the government, which is obviously where they're trying to get back to, and which is what we're moving towards, probably more of a dispute situation. We've been fighting since February for good working conditions and safe working conditions for our members in terms of, you know, hand sanitizer and social distancing, and we're having to keep push on that. And, you know, I think the network we've have of our health and safety reps has really come to the fore during the pandemic. We obviously were organised on a branch basis and site basis in terms of our health and safety reps, but we've also had regional reps in England and officers in Scotland and Wales as well. And we've pulled that team together to provide real support to the branches on the ground, the reps on the ground, using the experienced reps who are shielding at home to provide advice and guidance to the reps in the workplaces, some of whom are quite inexperienced in terms of dealing with health and safety. But also that's been invaluable in terms of what we've been doing, pooling that knowledge, expertise and information in terms of what we're doing in terms of challenging the employer at national level as well. So plenty of stuff to be getting on with, and, you know, our fight you know, will really be continuing. And I think certainly whether it's the support I've been giving to branches where they've had to organise workers outside a workplace in a socially distanced manner, whilst forcing the employer to take social distancing seriously in a workplace where there's a cluster of cases, to negotiating a good checklist for local managers to use so they know exactly what to do if there's a suspected or confirmed case in a workplace to stop the spread of the cases in that workplace. So actually having to issue a union inspection notice to the whole of the department because they haven't been taking all the health and safety issues seriously. So, you know, we're challenged at national level, but also we're encouraging our branches to do that at local level, to highlight all the failures of management to actually take the health and safety issues seriously. But I think what is very clear, and I think it reflects some of the points that the other speakers have made, is, you know, I think what has been really exposed during the whole of the pandemic is who matters in society. And it's, you know, low-paid workers, undervalued workers across the piece, whether we're in the private sector or the public sector. And, you know, we are the ones that society needs at the moment, and society really needs ordinary working class people who are actually providing the essential services to everybody in our communities. And, you know, I think the fact that that has been so exposed, you know, the super rich, the bosses, the politicians don't matter, but actually shop workers matter, benefit workers matter, local government workers matter, teachers matter, and obviously health workers matter, and all the support the people are giving each other in this really matters. So I think it's a really good basis to build on that union solidarity and actually, you know, sort of mobilise in our workplaces, show that we can make a difference, we can challenge every single thing that is not being done properly in our workplaces, get that sense that, you know, enough is enough, we matter. If they want us to deliver vital public services, then actually they need to take us seriously and give us good working conditions. And we're currently organising members' meetings in our job centre workplaces, whether we do it virtually or we do it physically in a safe environment for our members, to build up that collective sense that we can actually take these issues forward. And I think certainly having health and safety legislation to back up and give confidence to our members has been very useful. So there's a lot of individual rights in health and safety legislation, which we'll be making sure all our members know about, but making sure that they realise there's a whole of a union is backing them in terms of anything they want to do in terms of serious and imminent danger, but also looking at how we can build that collective response as well, in terms of taking on the management and the government in terms of what they're trying to make us do, which is completely needless and unnecessary in terms of reopening the job centre doors. So there's plenty that we're getting stuck into, but I think certainly all the work that we are doing with finding more reps, are very new, brand new health and safety reps that probably only volunteered at our AGMs earlier this year have been coming to the fore and really getting stuck in. So I think we've been organising, working together and building that sense of solidarity and support across our network of reps. And I think it's really sort of building our union. So there's plenty to do, but I think really positive. And I think certainly, as you said, I'm also president of Cardiff Trades Council, and I think those organisations have really come to the fore in terms of supporting reps locally and seeing what we can do to bring all the experience that we're all going through, how we're dealing with the pandemic, sharing that experience and actually sharing ideas and the fight back as well. Thank you.
Thank you so much, Katrine. Really, really fantastic to hear from you. And, you know, unlike some of the other panelists, your role is not just about prioritising the health and safety of you and your colleagues, but also the wider public. And you mentioned that you're moving towards a dispute, so please keep us up to date on how that develops so we can support in whatever way we can. And actually, if panelists want to share in the chat any social media accounts or ways to keep up to date with your union's campaigns, please do so. And I can't agree more on what you said, that society needs us at this time to step up and fight in the interests of our class. It's really lovely to hear from Anne, who said, I was feeling a little lost until I joined these webinars, especially today. I feel energised and like I'm not alone. Thank you all, fabulous speakers and chat input. I'm going to now move to questions. We've not got long. So what I've done is I'm going to ask 5 of the questions that have come in and then go back to all 5 of our speakers for very brief little answers. So if you want to answer one or more of these questions, then please feel free. So starting off, we've got Sophia, who asks, how do we get more funding for community-based health and safety advice, for example, the London Hazard Centre, to train, organise and provide information to reps and workers who are not in unionised work? Claire says that in her workplace, management has threatened disciplinary action if staff don't follow social distancing rules or wash their hands. It treats staff with contempt and it's not an effective control measure. So what do we do if we feel the risk assessment isn't good enough? Peter says, how can we encourage more young women to become health and safety reps? Rosie's question is really interesting. She says, when workplaces seem more keen on having well-being champions or welfare officers, how do you push instead for health and safety reps? And finally, Marion's question is about PPE. Can you tell us more about PPE not being designed for women and what we can do to raise awareness? And Marion, I'm actually going to share a briefing with you in the chat on that. So PPE, well-being versus health and safety, young women and health and safety reps. What do we do if risk assessments aren't good enough? And how can we expand the provision of health and safety advice in the community, like the Hazards campaign? I will go in the order that people spoke. So in that case, I'm going to Hayley to start off with. Here you go.
Hello, yeah, sorry, I was just trying to unmute myself there. I'll just answer one of those questions. Disciplinary action if the measures aren't followed. Now, clearly that's quite a draconian way for management to tackle that. However, my best advice would be that people should, or employees, members should be following the measures, because it is for their own health and safety. It's not just about passengers or shoppers or anybody else within our working environment. It's hugely important to stress the necessity of following those distancing measures, along with whichever PPE is necessary if you have to approach somebody within 1 metre. I doubt very much, I mean, I don't know which workplace you're talking about. I doubt very much if they will actually follow up on disciplinary action with regards to not following the measures. However, I would certainly list it for the next LDC meeting, as in, so for the next local reps meeting, and also perhaps talk to, you know, people within the union at a higher level and try and get them to challenge that management action. Okay, that's me done.
Thanks, Hayley. I'm going to go to Cheryl next.
Yeah, I'll take one of those questions as well. So in terms of trying to recruit young women, what I would suggest is just a matter of it's hard to keep on targeting our younger generation, but we're going to have to. It's in terms of what type of meetings that we attend, in regards to who are we going to target, what meetings will we target. So that means Labour Young meetings, and that sort of way how I would go about it, through emails as well, letting them know exactly, you know, this is the way we can make a difference, because we have got a lot of power, especially within this pandemic. The amount of powers that we currently have is it's been more than you have as a workplace rep. So, and this is why I would encourage our younger workers, especially our women, to be health and safety reps. But as I said, it is a difficult feat, because as like what I said, I did actually see it as a job, as a job's worth, and it's a thing where, how do we change that perception? And it's going to be about us actually, as health and safety reps, as women, to actually give out the message that no, it isn't. It's more than that, and it's more that we can actually do around that. So yes, that's the only way. But it is a difficult feat to try to overcome and conquer. But yeah, if anybody else has got any more suggestions, and that would be great. But also, what I would say as well, social media is a great thing, and I think we should use social media as well. So yeah, so that's me.
Thanks, Cheryl. I'm coming to Janet. Janet N.
Yes, hiya.
Okay.
Well, I just a couple of them. The first one's on the wellbeing issue versus trade union reps, and absolutely we need trade union health and safety reps. We need them in official roles, and we need our employers, our unions, to notify our employers directly, because in a champion, being champions, you've not got the rights of a safety rep. You haven't got the SRSC regs behind you. You haven't got the right to be consulted, to be involved in the risk assessments, to be able to do the inspections. And so it's really important that we have properly elected or appointed health and safety reps, because that gives you the powers to be able to do the job and to challenge your employers and make sure that we hold them to account. And you know, and that's why it's important to be health and safety reps. And just quickly on the funding for hazards, the hazards campaign, which we were remiss if I didn't say anything about it, and that is, we're desperately short of funding in the hazards campaign. You'll know, because of the we've had to cancel the conference this year, etc. So really, any support that you can give us in your trade union branches, and you know, we offer free support to any worker and rep and trade unions. But we're desperately short of funding this year. So anything you can do to support us will be helpful. Thank you very much.
Thanks, Janet, and I echo that call. Anything anyone can do to support Hazards campaign, please do, and at the very least, please sign up to their mailing list. Over to Janet H.
Hi. I would just like to touch on maybe the disciplinary action against people not following the restrictions in the workplace. The restrictions are the rules are there for everybody to follow. So if it's not just for our safety, but it's also for the safety of the customers coming into the workplace. If, for example, if you'll come walking through my store, for example, and saw the colleagues not following the restrictions, why would they bother doing it? So, if there's threat of disciplinary action, maybe we need to reiterate the rules to the staff so that everybody understands what is expected of them before it gets to the point where they have to go down the route of going down to disciplinary action. And with the young women, getting young women interested in becoming health and safety reps, we need to explain to them that they have a voice. They should use their voice within the workplace, bring forward the issues that affect our young workers, students, people that are are going through, especially retail. We have a lot of students that are there, so the young voice would be appreciated. And as Cheryl mentioned before, you could use social media to reach out to these young women, and put as much information on your notice boards as possible to encourage them to become health and safety reps. Yeah, that's me. Thank you.
Thanks, Janet. And then last but not least, it's Katrine.
Cheers. I think a lot of employers do try and undermine the union in terms of trying to organise the well-being type groups and so on. But it's about asserting ourselves in the workplace, and clearly we have rights under legislation to have health and safety committees and so on. And the issues in terms of stress and staffing shortages and everything else, and all the mental health issues, then clearly as a union we've got more oomph in terms of actually dealing with those issues and tackling them. So I think it's a challenge that we have to keep pushing, but also involving our members in terms of showing that it's more productive in terms of what we do collectively to defend those interests of members that need our support as well, and challenging the employer. I think in terms of dealing with employers that try and put all the onus on the employees to deal with the health and safety issues during the pandemic. I think we've been pushing very hard the responsibility of the employer to keep us safe in the workplaces, where you can keep pushing on that and organise the members. Obviously, we've been encouraging our members to follow all the health and safety guidance, follow all the safety measures, but also challenging the employer, and also in the processes in terms of looking at when we do have cases in our workplaces, is making sure that people feel able that if they haven't conformed to social distancing guidance, they're very clear, and there's no problem if they come forward, because this is ultimately about stopping the spread of COVID in our workplaces. So we've been very firm on that nobody should be penalised for actually saying, oops, I didn't quite do that right, and making sure that they can self-isolate as well. So all of those things, I think it is about asserting our authority in the workplaces, but there's never been a better time for us to do that. And the more that we do that, the more we can build that collective strength in our workplaces and keep challenging the bosses.
Thank you, Katrine. That's a really good note to end on as well. And thank you to all the panellists. I'm clapping, but quietly. You've all been fantastic. And I have to say, what Anne has posted in the comments is exactly what I think. Thanks to you all. You've been informative, experienced and passionate, and I'm inspired by you all. Thank you. Keep safe. We've run a little bit over time, but I'm really glad that people were able to stay and listen. This webinar is being recorded and it will be uploaded at a later date to the TUC's YouTube page. So if you know anyone that you think will find it useful, you'll be able to share it with them. And I have to say thank you all again. I hope you can go and enjoy the rest of your weekends, but solidarity to you all in the fight for safer working. You're clearly all absolute credit to not only your unions but your workplace and colleagues, and it's been fantastic hearing from you all.
Thank you, Cheryl.
Stay safe, everyone. Solidarity.
Thank you.